Goodpasture syndrome is a rare autoimmune disease that can be very serious. It affects the lungs and kidneys. This disease happens when the body's immune system makes antibodies that attack the collagen in the lungs and kidneys. Collagen is a protein that helps make the body's connective tissue. At first, Goodpasture syndrome can cause vague symptoms like feeling tired. But it can quickly get worse and affect the lungs and kidneys. If it's not found and treated fast, it's almost always deadly. The reason why the immune system attacks collagen in the lungs and kidneys is not fully understood by researchers. Some believe that Goodpasture syndrome may have a genetic component, as it can run in families. Other factors that may increase the risk of developing this syndrome include exposure to certain chemicals like hydrocarbon solvents and the weed killer paraquat, as well as exposure to metallic dust. The use of certain drugs, such as cocaine, and tobacco smoking may also increase the risk. Additionally, viral infections can also be a factor. Goodpasture syndrome usually affects young men, particularly those between the ages of 20 and 30, as well as older individuals over the age of 60. It is more common among white individuals. The early signs of Goodpasture syndrome can include feeling tired, nausea and vomiting, having trouble breathing, having pale skin. If the syndrome affects the lungs, symptoms like shortness of breath can quickly turn into a persistent cough, sometimes with blood. When Goodpasture syndrome affects the kidneys, symptoms may include making less urine, seeing blood in the urine, having foamy urine, swelling in the legs, high blood pressure, feeling a burning sensation or having difficulty when urinating, feeling pain in the back below the ribs, swelling in the hands and feet. Although Goodpasture syndrome can cause life-threatening bleeding in the lungs, it usually doesn't cause long-term lung damage. The most serious consequence of Goodpasture syndrome is kidney failure, which may require either dialysis or a kidney transplant. If you notice the symptoms of Goodpasture syndrome, such as coughing up blood, difficulty breathing, or swelling in your legs, it's important to see your doctor right away. Your doctor may order several tests to diagnose Goodpasture syndrome, including a urinalysis to check for kidney damage, a blood test to look for antibodies that attack the lungs and kidneys, a chest X-ray to identify lung damage, and a biopsy of kidney or lung tissue to confirm the presence of Goodpasture syndrome antibodies and assess the extent of any damage. Goodpasture syndrome requires immediate and aggressive treatment to combat harmful antibodies, manage fluid accumulation, regulate high blood pressure, prevent severe lung and kidney damage. Treatment typically involves oral immunosuppressive medications like cyclophosphamide and corticosteroids. These medications help decrease the production of Goodpasture syndrome antibodies by the immune system. In certain cases, intravenous corticosteroids may be necessary to control lung bleeding. Depending on how the patient responds to the therapy, treatment with immunosuppressive drugs may continue for 6 to 12 months. Treatment for Goodpasture syndrome also often includes a procedure called plasmapheresis, which helps eliminate harmful antibodies from the blood. During this procedure, a small amount of blood is drawn from the body and separated in a centrifuge. The red and white blood cells are mixed with a plasma substitute and returned to the body, while the component containing Goodpasture syndrome antibodies is removed. Typically, plasmapheresis is performed daily for several weeks. Goodpasture syndrome can last from several weeks to as long as 2 years. While the disease runs its course, some patients may require supplemental oxygen or a ventilator, and others may need blood transfusions.